All right, this is a review of Lab 4, which is arm, cubital, fossa, and forearm. We're just going to go over the slides that are given to us. Before we do that, I just want to review the brachial plexus. So we have C5, C6, C7, C8, and T1 as our basically sources of our spinal nerves that are coming out and giving us really five major nerves that are going to innervate the arm and the forearm, specifically the musculocutaneous axillary nerve, radial nerve, median nerve, and ulnar nerve. So I started to sort of write this out a little bit, but we have the muscular cutaneous nerve, and that's going to innervate a lot of the arm, specifically the anterior portion of the arm, so anterior part of arm. All right, so what are we talking about there? The biceps, the coracobrachialis, and the brachialis. Then we have the axillary nerve, which we know, of course, is the deltoids and the teres minor. The radial nerve is going to be the posterior compartment of the arm muscles and forearm. And then, so this is these two are really nice because we can think about the compartments of the arm and knowing, oh, radial is posterior arm. That's, half of the arm and forearm, great. And then the musculocutaneous anterior part of the arm, not the forearm, just the arm. And then we have the median nerve, which is going to be most of the muscles of the forearm, except 1.5 muscles that the ulnar nerve is going to innervate. Okay, and then the median nerve will also innervate parts of the hand, which we'll talk about in the next slide review. And then ulnar, same thing, part of the hand, and then the 1.5 muscles that the median nerve doesn't innervate in the anterior part of the forearm. All right, but when we're talking about these nerves in this review of labs, these are coming off of the brachial plexus, and they're innervating the muscles of the arm and the forearm and the hand. All right, so cool. So starting with the cutaneous innervation of the superior and inferior regions of the anterior arm. My goodness. All right, so this one is going to be a little bit challenging. I think this is a case of mostly memorization, but you can apply a little bit of logic here. Starting with the axillary nerve, we know is the deltoid. So if you have the a nerve on top, clearly on top of the deltoid, it's a good sign that's the part of the axillary nerve, and then you can go based on the position of the nerves on the skin relative to the body, right? Superior, lateral, and so here we have the superior lateral cutaneous nerve of the arm, all right? So we can see it's superior, it's lateral, and it's on the deltoid, so this is the axillary nerve, all right? Then we have over here the medial cutaneous nerve of the arm. We know that it's more medial, right? It's skin cutaneous nerve of the arm. Other than that, I think we just gotta memorize that. Here we have intercostal brachial nerve. Again, just gotta have to memorize that one. Over here, maybe a little bit kinder. We said radial nerve is going back to here. Radial nerve is the posterior compartment of the arm and forearm. And so you can see that it looks like our cutaneous nerves are wrapping around the arm here. And so you're like, okay, well, it's wrapping around, come from behind, then radial nerve. And so inferior lateral, all right, so it's further down than the deltoid region. So inferior lateral, of course, it's outwards, and radial nerve. Then we have down here posterior cutaneous nerve. All right, so posterior being behind, cutaneous nerve of the forearm, also from the radial nerve. Posterior, we think posterior, radial. All right, we love the radial nerve. Keeps things simple. All right, and then on this side we have branches of the medial cutaneous nerve of the forearm. We have basically, you're just gonna have to memorize that one too. And then the lateral cutaneous nerve of the forearm from the musculocutaneous nerve being right here. Not a great way of memorizing that. Musculocutaneous nerve, we do know, of course, is doing the interior part of the arm from our brachial plexus. All right, main course of veins. So right here we have the axillary vein. And over here, the cephalic vein. We do remember, of course, that it's a little bit confusing to see here because it looks like this is the main branch, but we know that the cephalic vein actually leads into the axillary vein. Then the axillary vein becomes the basalic vein, which continues all the way down the forearm into the hand. The cephalic vein continues down as well. It doesn't change names and continues into the hand through the snuff box. And that's the snuff box is on the side of your thumb. It's that indent that you can feel right below your thumb. All right, can you list the muscles that are interior and posterior compartments of the arm? All right, so posterior is really easy because we just have the triceps. We know there's 3 parts of the triceps. Right? 3 ceps. So we have the lateral part, the long head, and the medial. Medial is deep to the lateral long heads. We know that the triceps are posterior, and what did we say innervates the posterior part of the arm? The radial nerve. All right, so the triceps is going to be innervated by the radial nerve. Great, and we know that the long head of the triceps is going to insert on the infraglenoid tubercle. And then the lateral medial heads are going to insert along the humerus. Different parts. We'll cover that a little bit later, I think. All right, and then the anterior parts, we have the coracobrachialis, the biceps brachii, and the brachialis. And we said that the anterior part is innervated by the musculocutaneous nerve, right? C5 through C7. Great. All right, and what divides the anterior from posterior part? We have the medial muscular septum right here, and we have the lateral intermuscular septum right here. All right, so intermuscular septum. All right, and then can you describe the attachments, innervations, and actions of the biceps brachii? All right, well, we know that there's the biceps has the long head right here, and it has the lateral head. We know this is anterior, so this is the muscular cutaneous nerve. As one of the terminal parts of the brachial plexus, that's C5 through C7. We have the long head inserts at the supraglenoid tubercle, and the short head inserts at the coracoid process. So when I say lateral head, long head and short head, this is the short head. This is the long head right here. Okay, and then we have these are the origins. My goodness, I'm getting tired. These are origins. Insertion is down here at the radial tuberosity of the radius. All right, and then moving on, we have the brachialis and the coracobrachialis. So deep to the biceps, we have the coracobrachialis right here. And again, we're in the anterior part, so we're dealing with the muscular cutaneous nerve from the brachial plexus, C5 through C7. And same thing with the brachialis, right here, this guy, muscular cutaneous nerve. We love the muscular cutaneous nerve. Keep things simple. Anterior part of the arm, muscular cutaneous nerve. Posterior part of the arm, radial nerve. All right, brachioradialis is a forearm flexor. Nice. Coracobrachialis, also forearm flexor. And the insertions are along the distal humerus for the brachioradialis. You can see it's along the shaft here. Coracobrachialis, the insertion is here on the coracoid process. You can see it's slightly inferior to the short head of the biceps insertion. And then the brachialis muscle is inserting along the tuberosity of the ulna, and the coracobrachialis is inserting, the medial mid-shaft of the humerus. Okay. All right, very good. Brachial artery, we have basically as a renaming of the axillary artery. So we're starting at the axillary artery. Remember we said we had 3 parts of the axillary artery. And what gives us those 3 parts? Remember the pectoralis minor is our placeholder for separating the parts. And then we have the axillary artery turns into the profunda brachii artery, and that's going to supply the anterior muscles. The continuing along, so axillary artery to brachial artery down here. Brachial artery is going to split and become the ulnar artery and the radial artery. Those are easy to remember because they just follow the radius and ulna. Cool. All right, so not too much to know there, but that's kind of a nice thing sometimes. Can you summarize the main arteries that provide branches for collateral circulation around the elbow joint? All right, so we said we started with the axillary artery. Cool. Then it becomes the brachial artery. Nice. The axillary artery has the profunda brachial artery branch off, right here. And we know that this is going to give us the blood flow for the deltoid, part of the deltoid, to the brachialis. All right, and then posterior arm triceps. All right, then we also have part of the forearm, the aconius, and I'm sorry guys, I said earlier, this was giving us anterior arm. These are what it's giving us. All right, we can see that the profunda brachial artery will eventually become the radial collateral and the middle collateral, and those eventually will come down and meet up with the posterior interosseous artery. Brachial artery comes down. We again said it breaks into radial and ulnar artery. And then the ulnar artery has a branch off, which is the common interosseous artery, and that splits into the anterior interosseous artery and the posterior interosseous artery. And you can see it's on different sides of the interosseous membrane right here. Okay, not too bad. You can see they're all linked up. All right, so basalic vein in the distal arm. So we have the axillary vein, we have the cephalic vein right here, and it's a little bit better picture we saw earlier. We can see cephalic vein leads into the axillary vein. We have the axillary vein is going to give off the paired brachial vein, which we can see is actually following the brachial artery. So the paired brachial veins are following the paired brachial artery. The axillary artery is turning into the basalic vein, which continues along the ulna. Then the cephalic vein continues along the radius, and both those make it to the hand. Okay, and great. Moving on. All right, nerve branches from the brachial plexus. All right, so we went over the brachial plexus at the very beginning, but these 5 branches, terminal ends of the brachial plexus, are going to innervate the different parts of the arm. So muscular, cutaneous, anterior part, axillary, radial, median, and ulnar. So let's get back to that. And here we are. So we have lateral medial cord. All right, so we have our medial nerve. We have our muscular cutaneous nerve, the anterior part of the arm. Medial nerve is going to be most of the forearm, except for a tiny part that the ulnar nerve is going to get to. This will also be a part of our hand. And same thing here, ulnar is going to give us part of our hand innervation, which we'll go over in no time. And then our radial nerve back here. We said we like the radial nerve because posterior part of arm and forearm. Okay. Can you recognize the skeletal structures of the distal humerus in both the anterior and posterior views? And could you find some of these structures on a radiograph? We sure hope so. All right, so we have the humerus, distal part of the humerus right here. We have the coronoid fossa for the coronoid process, which we will see shortly over here, right here. It's a little groove on the ulna. All right, and so when that flexes up, the coracoid process will go, or coronoid process will go into coronoid fossa. Then we have the radial fossa for, again, the same thing. When the radius flexes upwards, it has some space. Important one to note is the medial epicondyles. It's really obvious to see. Then we have the trochlea and the capitulum. The capitulum is for the radius, and the trochlea is for the ulna. All right, we know we have the olecranon fossa for the olecranon. I can't pronounce anything. Here we have the radius with the head, the neck, radial tuberosity. Radial tuberosity is for the insertion of biceps. Okay. Here we have the ulna, and so we can see there's a radial notch for where the ulna is touching the radius, the trochlear notch for where it is in contact with the trochlea of the humerus, right here. All right, and then you have the tuberosity of the ulna, which the tuberosity of the ulna is where the brachialis, one of the muscles of the anterior part of the arm, inserts. The coronoid process is going to be able to go in right when the forearm flexes upwards. There's room for the coronoid process and the coronoid fossa, and then roughening for the aconius, which is part of the forearm muscles. All right, cubital fossa. Cubital fossa is this right here, and we have, why we like cubital fossa, because we can find it pretty easily. It's our elbow, triangular shape in the elbow, and it has 3 parts that are easy to identify. And specifically, we have this nice tendon, artery, and nerve. And so the tendon is the tendon of our biceps brachii, and our biceps brachii again is going to the radial tuberosity of the radius, right? So the tendon's coming down to the to radius. And then we have the median nerve, and again, we said median nerve is doing most of the innervation of the muscles of our anterior forearm. And then we have the brachial artery. So tendon for the biceps, artery, brachial artery, and nerve, median nerve. All right, and so what are the boundaries of the cubital fossa? Well, we have this nice line from our medial epicondyle, right? It's a really big part right there, and the lateral epicondyle of the humerus. Then we have the pronator teres, one of our superficial muscles of the forearm, and then the brachioradialis, which is also our forearm muscle. Okay, and continuing on. All right, radial nerve, we just have radial nerve, again, we said is posterior part of the arm. So it's innervating, and so it's continuing along the arm, and really on the opposite side of the ulnar nerve, but it's got a deep branch, not too much there. Components of the arm, what structure divides them? Well, we have the interosseous membrane between the radius and the ulna, and then we also have the lateral intermuscular septum. And remember, in the arm itself, we go way back, we had the compartments of the arm, the anterior and posterior, divided by the lateral intermuscular septum and the medial intermuscular septum. And so on the forearm, we have the interosseous membrane between the radius and the ulna, and then we have the lateral intermuscular septum, and we have the lateral intermuscular septum on the arm as well. But instead of the interosseous membrane, which we have on the forearm, we have the medial intermuscular septum. All right, superficial muscular layer of the anterior forearm, our acronym for that is pass, fail, pass, fail. Pass being pronator teres, fail being flexor carpi radialis, pass again being palmaris longus, and then fail being flexor carpi ulnaris. All right, we said the median nerve is going to innervate the anterior part of the forearm except 1.5 muscles. All right, so what is that 1.5 muscle? Well, only one of the 1.5 muscles is on the superficial layer of the anterior forearm muscles, and that is the flexor carpi ulnaris, and that's going to be innervated by the ulnar nerve. All of the other ones are going to be median nerve. All right, and then what's the 1/2 muscle that is innervated by the ulnar nerve instead of the median nerve? That is in the deep layer of the anterior forearm, and it is the flexor digitorum profundus, and that is the ulnar half, the medial half of the flexor digitorum profundus. Okay, so that's it for this lab 4. Good job, man, and keep going. All right, so very quickly, just go over the surgical scenario from lab 4. Arm, cubital fossa, anterior flexor forearm. Adam is a 28-year-old male patient presenting with a distal bicep tendon tear. Ouch. He has suffered the injury when lifting a heavy object and heard a sharp pop in his right elbow/cubital fossa. He noticed swelling discoloring in his interior elbow and his bicep muscle was rolled up. Yikes. Upon physical examination, there is restricted range of motion due to pain. He cannot flex his arm at the elbow joint. MRI shows evidence of distal biceps tendon tear. All right, so distal down here versus, so this would be our, distal is more down, versus proximal up here. Okay, so what is the distal attachment of the brachii muscle? All right, well, let's take a look real quickly. Here's our brachii muscle, and you can see that if we zoom and look, our brachii muscle is attaching to the radial tuberosity on the radius, so right there. All right, so most likely that's where our tendon tear happened. So the radial tuberosity of the radius. In addition to flexing the arm at the elbow, what is the other action of the biceps brachii? All right, so the other action is supination. All right, and so what is supination? Well, imagine laying your hand down on a table. You can see your nice little fingernails, and then you go ahead and you supinate, and now you have your fingernails on the other side. You can see the lines of your palm. All right, cool. All right, so that's it, and we finished lab 4 review.